Hi, everybody. We're going to go ahead and get started. I want to welcome everybody to the fifth meeting of CSG's National Long-Term Care Workforce Network. I'm Sean Sloan. I'm a senior policy analyst at the Council of State Governments here at the national headquarters in Lexington, Kentucky. Here is our agenda for today. After a quick introduction and project recap from me, we will introduce you to our three presenters. Dr. Rachel Werner from the University of Pennsylvania is going to talk about her recent research on how the home care workforce has not kept pace with the growth in home and community-based services. Vicki Hoke from the Home Care Association of America will join us to discuss the policy agenda for addressing those challenges. And April Young from Advancing States will talk about state initiatives being deployed around the country. We encourage you to make liberal use of the Q&A and chat functions here in Zoom to submit questions and comments, which we will turn to in the last half of the meeting. Please stick around until the end, and I'll give you details about our next network meeting, which is coming up next week on Tuesday, on August 1st. So just a quick reminder of what our current project is all about. Last year, with the support of the Commonwealth Fund, CSG put together an 8-state interbranch task force of state policymakers that convened multiple times over the course of the year and advised us as we put together the CSG Long-Term Care Policy Guide, which you can find on the CSG website. One of the three focus areas that we had for the project last year was revitalizing the direct care workforce and supporting family caregivers. And in the policy guide, you'll find a number of strategies states have deployed to address those issues in recent years. For this project, we've narrowed down our focus to workforce concerns. We've also expanded our scope to include the long-term care workforce writ large, whether we're talking about nursing home clinicians, as we did last month with our friends from AMDA, the dementia care workforce, as we did at our May meeting, or the home care workforce, as we are focusing on today. We are pleased to again be working on this project with the Commonwealth Fund to build on the work that we did last year. This project includes using the model for last year's 8-state task force to build out this national long-term care workforce network. We're developing a new website, a national online resource center that we hope will become a clearinghouse for all the relevant work being done on long-term care workforce policy around the country. We hope our network members will share relevant legislation, policy reports, and other materials that we can post to the website. And if you have links you would like to share today, please feel free to make extensive use of the chat and Q&A functions here in Zoom. You can also tell us about who you are, if you're new to these meetings, and perhaps connect with other attendees working on these same issues in other states. And of course, you can submit questions for our presenters today. We also, with this project, have the opportunity to provide technical assistance services for up to 5 states. This is something we're really excited about, and we will be ramping up our promotion about in the coming weeks. If you believe policymakers in your state could benefit from a detailed briefing and action planning session on how they might move forward with policies to address long-term care workforce needs, please get in touch. So without further ado, I want to welcome our first presenter, Dr. Rachel Werner, is Executive Director of the Leonard Davis Institute of Health Economics at the University of Pennsylvania. She's the Robert D. Eilers Professor of Healthcare Management and Economics at the Wharton School and a Professor of Medicine in the Perelman School of Medicine. She's a practicing physician at the Philadelphia VA. She was also a member of the National Academy's Committee on Nursing Home Quality that resulted in the 2022 report, The National Imperative to Improve Nursing Home Quality, which we've heard about at several of our previous meetings, including most notably our meeting with the Moving Forward Coalition, which just last week released their action plans for addressing those issues identified in the report. And Dr. Werner was also a member of Moving Forward's Financing Systems Committee, I believe. She recently co-authored an article in the journal Health Affairs titled "The Home Care Workforce Has Not Kept Pace with Growth in Home and Community-Based Services." And I understand your co-author, Amanda Kreider, may be joining us today as well. Thank you both for being here. Dr. Werner, please take it away.
Great. Thank you, Sean. And thank you so much for having me. I am really looking forward to this important conversation today. I am here with Amanda Kreider. She is in the audience today. She's the co-author on this work and collaborator on related work around this. And so while I'm presenting, she's done most of the hard work behind this. I wanted to just set with some level setting. I know that all of you in the audience know this, but it's easier to, I think, to start, make sure we're on the same page as we move forward. So there are 9 million people in the US who rely on help with their activities of daily living. This number is expected to grow as the population grows with the aging of the baby boomers. Many of the 9 million people who receive help with their ADLs do so through formal long-term services and supports. Historically, this help has been provided in nursing homes and other institutional settings, but over the past several decades, this has largely been shifting to home-based care. This care is more consistent with people's preferences, and for many, this shift is made possible by Medicaid financing of home-based supports through home and community-based services. So on the next slide, we see a graph of that shift from the institutional setting to the home-based setting. This is showing the total Medicaid long-term services and supports expenditures. And as you can see, since 2013, Medicaid has spent more on home-based care through home and community-based services than it has on institutional settings. And now we're approaching 2/3 of Medicaid spending nationwide is on home-based care. So on the next slide, the US in total has spent over $400 billion on long-term services of support and supports in 2020. And the majority payer for this $400 billion is Medicaid. On the left-hand side is the Medicaid spending on institutional care, mostly in nursing homes. And while in that setting, only about 1/3 of care is paid for by Medicaid, on the right-hand side is a home-based settings. Medicaid spending is by far the dominant payer, with 2/3 of the care paid by Medicaid, totaling about $162 billion in home and community-based supports. On the next slide, so home and community-based supports are offered across all states in the country, but the amount and the types of supports that are provided really varies. So all Medicaid state programs are required to provide home health services. Home and community-based services are optional. This shows the number of users of the types of home-based care, along with the number of states that are participating in each program. So on the left, you see the orange bar, which is home health care. All 51 states, I guess that's 50 states plus DC, participate in this because it's mandatory. And then on the blue bars on the right show the different home and community-based programs, from the state-based personal care services to the Section 1915 waivers, Section 1115 waivers, and the different varieties of home and community-based supports that are available across the states. And you can see that not all states participate in any one of these, but most states participate at least in the 1915 waivers. On the next slide, the level of participation across home and community-based services, although large, is still variable across states, even with all states participating. And this just shows the percentage of each state's Medicaid budget, long-term services and supports budgets that is spent on home and community-based services. And so you can see that it varies from over 75% in 4 states to under 50% in a handful of states across the middle. But as I said, over time, on the next slide, we do see an increase in the amount of home and community-based services being delivered, the types of care being delivered, and the number of states that are participating. The majority of home and community-based care is still home-based services, and this is work done by a couple of my colleagues that was published last year in Health Affairs, which really just documented the service categories covered under 1915 and 1115 waivers. Home-based care, as I said, is most common, but the other types of services are growing. So we have growth in the number of states participating in home and community-based services and the number of individuals participating in home and community-based services. But on the next slide, we've also at the same time heard a lot about a shortage of home care workers. There are some reports that these shortages have worsened over time. Some of that may be due to the pandemic. And this is a recent news article suggesting that the pandemic caused a shortage in workers that has left families struggling. The next slide has some more news clips, and this has really been in the news a lot because of the urgency of the situation, suggesting that shortages may be coming from the aging population. There are long waits for many people for home-based care, and really what many people think of as a crisis in staffing for home-based care. There hasn't been a lot of formal documentation about the size of this workforce and whether it's big enough to meet the demand. The next slide shows some of what we know from the pandemic. And so this is based on data that the Kaiser Family Foundation collected during the pandemic, showing that the workforce in healthcare generally, but specifically the dark blue line in home healthcare services shrunk during the pandemic. At its worst, the care provision dropped by just over 7% early in the pandemic, but then rebounded back to where it was at baseline. But it's really unknown what's happening over the longer term. Over the past decade or two, when we've had increasing number of people enrolled in home and community-based services, has the home-based workforce grown to meet those demands? So on the next slide, this is work, as I said, that I did with Amanda Kreider. She led this work. And our question here was, given the national focus on improving access to home and community-based services, we wanted to understand whether the home care workforce has expanded to sufficiently meet the needs of the growing number of participants in the home and community-based care. We undertook this study using national data on the number of home care workers in the US and data on the number of Medicaid home and community-based services participants, with the goal of examining trends in the size of that workforce, the home care workforce, relative to the number of people enrolled between 2008 and 2020. So the first results are shown on the next slide. Using data from the Kaiser Family Foundation on the number of Medicaid HCBS participants in each state during the period of 1999 to 2020, we see that the number of participants more than tripled during this period. And so these participants are broken down by program authority, and you can see that across all of these programs, the number of participants in these services increased from about 1.1 million in 1999 to 3.4 million participants in 2020. In addition to the overall growth in home and community-based participation, the relative importance of the 5 different programs listed here also changed over time, with the 1915 waivers being the predominant mechanism to pay for Medicaid HCBS between 1999 and 2010, followed by state plan personal care. And then beginning in 2011, there were a number of other programs that began and increased in relative importance, with newer options such as Community First Choice, which is now rapidly growing. So we see an increase in the number of participants in receiving home and community-based care. And then the next slide looks at the number of home care workers. And so for this, we estimated using the American Community Service Survey, which is a large representative sample of 3.5 million households. The survey is conducted annually by the Census Bureau and is designed to capture the demographic, socioeconomic, and household characteristics of the entire US population. We used this survey to estimate the number of home care workers, which we defined as direct care workers who are working in a home-based setting. And we did so for each year between 2008 and 2020. And so what you see is the home care workforce also grew during this time period. It grew from about 0.8 million to 1.4 million workers by 2019. And then these estimates suggest the number of workers fell slightly in 2020 to just under 1.4 million. However, this last estimate should be interpreted with caution because the ACS, like a lot of other surveys during the pandemic, suffered from data quality issues. And so there's some question about the reliability of the 2020 estimate. Our next step was then to directly compare the number of home care workers to the number of HCBS participants. And we did this very simply by taking home care workers divided by 100 HCBS participants in each year. And you can see in the gold line, so the light green line and the dark green line are the numbers I showed you on the previous 2 slides. The gold line is the ratio between those two. And what we see is that the number of home care workers per 100 Medicaid HCBS participants rose nationally between 2008 and 2013, going from about 41 to 50 workers per 100 participants. However, that ratio started to decline between 2013 and 2019, going from about 50 to 44 workers per 100 participants. And then preliminary estimates suggest that it further declined to 41 workers per 100 participants in 2020. And so we interpret this as being an inadequate workforce to care for the increasing number of participants who are enrolled in home and community-based care. We've also spent a little bit of time thinking about so what can we do about this, and are there policy levers that we can use to increase the workforce? So moving on to the slide after this one, I have found it helpful to better understand the demographics of this workforce when thinking about how to care for them. And so this is data that's collected by PHI and is reported by them about the home care workforce. And what they report is that the workforce is predominantly female. 85% of home care workers are female, and it's a relatively young workforce. It's also a workforce that reports a large burden of childcare and other caregiving responsibilities outside of work. And so one way to think about this is that it's hard to address the workforce crisis that we see in home care without simultaneously addressing some of the larger challenges within the labor market, like lack of access to universal childcare. This is also a population that reports limited opportunities to advance their career in their jobs as home care workers. And so there's a group of, I think there's a movement in some segments of the workforce to better support the workforce by providing career advancement opportunities through things like career ladders and training opportunities. Another issue that always comes up when talking about the workforce, and I'm an economist by training, is wages. So it's hard to talk about this without talking about wages. This slide here shows the inflation-adjusted median hourly wages between 2011 and 2021, and those wages actually rose from $11.43 an hour to $14.09 an hour in 2021. And so the home care workforce's wages increased slightly faster than inflation. That is relatively good news. It's still a relatively low wage, particularly in the context of the number of people who have full-time work. And so 63% of the workforce only works full-time, where 37% works part-time. In the context of low wages and part-time work, you end up with low salaries, or home care workers who earn a median annual income of only about $19,000 a year. So with 43% of them living in a low-income household and 1 in 6 living below the federal poverty level. On the next slide, I work with some colleagues here at Penn who have done some work about scheduling in the home care setting. And what they have looked at is scheduling variability or volatility, depending on which word you prefer, and found that there are high levels of schedule variability among home health nurses. This particular study was focused on nurses rather than home care workers like aides. But that is quite common for employees who work for home care agencies to find out what their schedules for the next day or the night before, at which point they may be told, that they start either at 9 in the morning or 1 in the afternoon. This is an effort to do something called just-in-time scheduling, or to more adequately match the supply of workers to the demand in real time. But it results in a high level of schedule variability for individuals, and that is associated with an increased odds that the nurse will quit by about 20%. So nurses that have a highly variable schedule are more likely to quit by about 20%. And then the last point I want to make is a study that Amanda Kreider is also leading on the next slide, which is about the role of immigration enforcement in the home care workforce. And so another statistic about the home care workforce is that about 30% of that workforce are foreign born, 17% by comparison in the among working age adults, 17% are foreign born. So a much higher proportion of the home care workforce is foreign born. You can see in this graphic that 13% are not US citizens. At the same time, over this period, this graph is showing from 2003 to 2021, the amount of money that we're spending as a nation on immigration enforcement has gone up. And so one of the questions that we are wondering is what effect this has on the size of the workforce. We specifically looked at this in immigration enforcement effort called Secure Communities, which is on the next slide. So Secure Communities was rolled out nationally over this period of time by county between 2008 and 2013. And it's a federal program that's designed to check immigration status of every single person who comes in encounter with local police. And so when police interact with local law enforcement, their fingerprints are sent to ICE rather than to the FBI, which was what was happening prior to Secure Communities. And this increases the likelihood that ICE will be able to detect people who are working in the US without documentation and deport people to their home countries. It's also concern, there's also concern that even among people who are working legally within the United States, it has a chilling effect on the labor force. And so people dropping out of the labor force out of fear for the family or for other people, for interaction with the police, local authorities. And so in a study that's ongoing, but which shows some interesting results to date, on the next slide, we have found that when Secure Communities was rolled out, the home care workforce declined by about 7.5%. So what this graph on the right is showing is the difference between counties where Secure Communities was rolled out versus counties where it was not rolled out by the number of years that Secure Community has been in effect. And what we see is before Secure Communities is rolled out, there's not much difference in the home care worker population between those counties with and without Secure Communities. And then after Secure Communities is implemented, the workforce declines. And again, it declines by about 7.5%. And that decline is concentrated among foreign-born workers, where it shrunk by 14.5%, but with no detectable effect among the native-born workers in those same counties. So I'm going to summarize on the next slide just to wrap it up and turn things over to Vicki as our next speaker. Just to summarize that the health affairs work that Amanda and I did provided new evidence on national trends in the size of the home care workforce by comparing the growth of this workforce to the growth in Medicaid HCBS enrollment. I think providing new and compelling evidence that the workforce growth has not kept up with HCBS enrollment. And also really supporting the idea that we need better approaches to bolster the home care workforce to maintain access to HCBS. So I will stop there and I look forward to the rest of the conversation. Thank you.
Dr. Werner, thanks so much for that presentation. We will reserve our questions until the end of the hour, so please stay with us. If you do have a question, you can submit it in the chat or the Q&A here on Zoom. We will ask as many as time allows. And Dr. Werner, as I suggested, feel free to take a peek and join the conversation in the chat if there's anything to respond to in there or anything we should bring to the attention of the full group as we move along here. Right now, I want to welcome Vicki Hoke to the conversation. She is the CEO of the Home Care Association of America. Prior to becoming CEO in 2019, she served as CEO of the Pennsylvania Home Care Association for 20 years. This spring, she announced her resignation from HCAOA, effective in October. So I'm sure a lot of folks are sorry to see her go, but we welcome her now. HCAOA put out a great report earlier this year on the home care workforce crisis that includes some great recommendations to address those workforce challenges. Vicki, thank you so much for joining us. What can you tell us?
Sean, thanks so much. What a great precursor to what I'm saying. Dr. Werner, thank you so much for this great statistical. That information is really important as I talk a little bit more about the industry itself and an agency and what they're facing. So if you go to the next slide, I think just to make sure everyone knows about this industry that I'm talking about, our association is a trade association. We represent pretty exclusively those agencies doing home and community-based services that Dr. Werner talked about. But these folks that we represent are your home care agencies doing primarily personal care services in people's homes. So when we take a look at our country, we're looking at about 26,000 of this type of home care agencies compared to home health agencies, which of course, everyone on this call, I understand, knows that this is mostly a Medicare-funded home health, and there are about 11,000 of home health agencies in the country. And then, of course, that other third sector that I always want to point out for home-based care is our hospices that bring end-of-life care into people's home. The common denominator being that all of our members are bringing care to the individual in their private residence. We're providing the personal, the supportive in-home care. And according to PHI, we're looking at about 2.4 million direct care workers doing this type of non-medical personal care. We know that the biggest thing that this industry is facing is what we're talking about today, which is our critical workforce. We are seeing, and I'm glad Dr. Werner showed this statistic, that since the pandemic, we have, and even before that, we've seen a pretty nice increase in wages. Let me quickly point out, it's still not enough. And it's really, really important for me to say that. Oftentimes when you hear people saying, I represent the provider side of things, they immediately say, oh, the providers versus the direct care workers. I want to really emphasize that having done advocacy work on behalf of home care agencies now for about 25 years, you know, what they say, all things happen for reasons. Probably about 5 years ago, my mother came, no, probably 8 years, came to live with me, and I became a family caregiver. And in order for me to continue to work, I had a home care aide in my home 5 days a week, usually from 7 a.m. till 6. Weeknights, it was me. Weekends, it was me. So I think, you know, when you talk about what home care is supposed to be, and then all of a sudden you become that client, you walk in the steps of what it means to receive home care, then it's a whole different experience. And it really has, I think, just kept me going for these last several years, because our family would not have been able to cope with my mother living with me without having a home care aide in my home. And the other thing is, we went through all the different stages. We had home health. And of course, at the end, my mother also received hospice care. I want to really stress that while Dr. Werner talked about Medicaid, which is so important when it comes to our direct workforce, it's also important for all of you to recognize that there are many families who are funding home care privately. We call it private pay. I like to call it family funded, because it is important. And there is a perspective that we never want to lose when we're talking about Medicaid, because many of the policies that are developed and initiated Medicaid really do impact family funded care. And I'll get back to that in a minute. I also want to talk about the fact that these home care agencies that are absolutely, this is a crisis that we're looking at right now, but there's also other types of programs that we're watching as well. And while Medicaid is huge, Veterans Affairs is also paying for a lot of home care in this country. I would say about 90% of home care agencies are doing veteran-funded home care, and that's important to keep in mind as well. And then, of course, long-term care is another big revenue, as well as any private insurances. So next slide, Sean, if you would, please. I think one of the issues that makes our workforce crisis, addressing it and trying to figure out how do we mitigate this crisis, is the way we are regulated. Now, remember, I'm talking about home care, which is primarily providing personal care in people's homes. It's also the folks that are doing mostly all the home and community-based services waivers under Medicaid. The problem becomes when you're looking to mitigate this crisis, you have to look at how we are regulated. And so we have this identity crisis in home care. We are very fragmented because every state licenses us differently. Only 30 states license this type of personal care, which I want to just keep in mind that I believe that this type of home care is just as important as receiving skilled care, that I think social determinants of health are important. And those are the kinds of things we address in the type of care that we bring into people's homes. And because of this fragmentation, when we look to try to figure out how do we mitigate this shortage, it's also, you've got to look at the state that you're working in. I think, Dr. Werner, when you were probably doing your Medicaid, and you've been doing it for so long, the great research that you do, you know that when you know Medicaid in that state. But the next state is going to be very, very different, as I'm sure everyone on this call knows. So when we're looking to mitigate this, it's really important to figure out what state we're talking about, because the regulations do impact our direct care workforce. Absolutely. For instance, the regulations that really talk about what does that direct care worker need as far as training. It's very different in states. And then you've got these states, and these are not small states, Michigan, Arizona, that have no regulations around this type of care. And then you've got to wonder, what is the training requirements? Are they checking criminal backgrounds and all those kinds of things? So we have that too to worry about. And the fact that we have no national standards to really address what are the national standards when it comes to direct care workers in this space of 26,000 agencies. And at this point, there are none. Let me quickly add that one of the things that I'm very proud of as a National Trade Association, we believe and we promote some kind of oversight. So we go into the states. I'm happy to say that in Ohio, we were successful in getting state regulations for home care. Most recently, I guess it was 2 years ago. But the whole thing about having national standards for these type of workers not only gives us that standard of care, but let's talk about just elevating the profession, which we know is really important when it comes to retaining and recruiting this workforce. Next slide, Sean, if you would. So this is the report that Sean referred to. We released it back in March of this year. Let me give you a little bit of background. We joined up with our other National Home Care Association, known as NAC, to do this report. And quite honestly, I really felt it was important for us to listen to the providers who are dealing with this workforce shortage every single day, to listen to what they feel some of the solutions might be. And, I know that everyone on this call has sat in on many other webinars addressing the workforce crisis at this point. And we're hearing a lot of the same things, but I am here to tell you that there seems to be a little bit give right now, that our members are telling me that they have candidates that are applying for their jobs. Back in April, I was still seeing one survey that we did. We were still seeing about 89% of our agencies having to turn away people calling in need of services. And all I could think of, folks, was when I was a family caregiver, if I could not get an agency to care for my mother, we all know what happens. And we all know that it did happen to many families who had to give up their job in order to care for their loved ones. So it was important for the provider community to talk about what they felt. That's what this report basically talks about. What are the problems? How do we mitigate this workforce crisis that we're dealing with? So if you'll go to the next slide, Sean, here's just a quick report, the themes and the takeaways. This report, by the way, is available at our website at homecareassociationofamerica.org. But pretty much, and this is the one I really want to stress, the first one out, which says the way out of this crisis lies partly with policy and partly with home care organizations. The industry must own our retention issues. Sure, there are a lot of policies that can be changed. I'm going to talk about one of them in particular, but when it comes to retention, the industry has to own that. Every agency has to own the fact that what is their turnover? Why do they have a high turnover? And the last turnover, we were up to 68% turnover. We know that in that first 90 days when that home care aide is hired, that's when we really have to pay attention to how are we onboarding that worker. And the retention is something that our association has done numerous webinars to our members, talking to them about lowering that retention rate. We also know that broadening the pool of candidates, that we always just kind of throw things out and just hope someone grabs our classified ad. But we also need to look at the older aged direct care worker, people that are leaving the nursing profession, but yet want to stay in that care business. They're good home care workers. So we need to make sure that we're looking at all different pools of candidates. And then this next bullet, creating that culture of caring. Every year we do a massive survey of workers who have applied for jobs to become direct care workers for home care agencies. And this particular culture of caring never appeared before, but it was up there in people saying, I've accepted this job because I felt the agency had a culture of caring. More so than ever before, workers are looking for a company that cares about them. Of course, they want them to care about their clients, but they also want to know that that agency cares about them. And so I thought that was really important, that that's something that agencies have to really think about, is what is our culture? I'm coming to work for you. Do I believe that you have my back? This became really evident at the height of the pandemic. We did a survey, just a satisfaction survey, to see how were our clients feeling during the height of the pandemic, and how were our caregivers, our professional caregivers, feeling. Folks, I was astounded. Do you know that at the height of the pandemic, we had the highest satisfaction scores than we've ever had before, both of clients and of our own workers? And I thought, wow, that says so. And you know what it was? During that time, and you all probably on the call know this, we were communicating every other week, right? Okay, now this is the most recent CMS guidance. This is the PPE that we have. Here's how you put your gloves on. Here's what you do. And also our communication with our clients, making sure they knew all the precautions home care agencies were going through to make certain that that direct care worker walking through the door of their loved one was not bringing COVID in. And so we talked about the precautions, about taking their temperature, all of those things. And I think that's something we should all keep reminding ourselves, that that's also important. And then that 90 days committing resources to onboarding. We know that people leave our direct care worker occupations because they don't feel they're trained enough. They want more money, of course. They also feel like they haven't been trained. And so we've given them a client that might need additional help, and they don't feel comfortable doing the Hoyer lift, that we haven't trained them. All of those things point to committing more resources to training, and also that first 90 days. And one of the best practices that's also mentioned in the report in regard to onboarding is having a mentor. The state of New York has done a great job piloting a mentorship program. It has proven to reduce retention of our workers. And then last but not least, we all want to feel appreciated and respected. We need to elevate the profession. We need to expand what they are permitted to do. You're seeing a trend across the country that for those states that do license our home care agencies, that many of our states are going to revise their regulations to allow our workers to do more. Let's face it, if we see, as Dr. Werner pointed out, that we're shifting healthcare and we're bringing it home, people have got to give a little bit more services that our direct care workers can do. I remember when we got our licensure in Pennsylvania, where our home care aides were not permitted to touch a pill. And that might sound funny to all of you, but it's pretty much a standard in all states. And I remember the surveyor saying, well, if they have trouble picking that pill out of that pill box, Vicki, just have your aide hold up and hold their elbow and help them, it's almost comical. But the bottom line, folks, is if we really want people to stay at home where they want to be, we've got to figure out what our families need. And they need help with medication compliance. I'm not saying they should do any, even pill box fills. I'll say, okay, that's probably out of scope, but yet we've got to figure that out, because as soon as they can't find the care, what will happen? Unfortunately, they'll have to say, I'm sorry, you're going to have to go into a facility. So next slide, if you would, Sean. Here are some of the recommendations that are in the report. I want to go over them quickly. There's two you can see. The first line is for home care direct care workers. The second line, we also looked at home care nurses, because I believe Dr. Werner pointed out we have a workforce shortage when it comes to nurses too, especially in the home care arena. And of course, that would be with home health agencies. So number one, develop an industry endorsed standardized training model. We've thought a lot about this, and if government can't do it, perhaps we can do it. I know Senator Casey probably 10 years ago had a bill that had a standardized training module for direct care workers. Now, this is something that elevates the profession. This is something that gives them value, that recognizes them. So that's one of the recommendations. And then, of course, something that Dr. Werner pointed out, immigration. Folks, we've got to figure this out. You're absolutely right. A third of our home care workers right now were not born in this country. We need to take a look at a temporary visa. I'm pleased to report that we are in a collaboration with Leading Age and the American Healthcare Association, looking at what we could do to reform our immigration laws. And let's be real clear, as soon as I walk into an office in the Capitol and say anything about immigration, red flags go up, whistles go off, and I can't get past it. However, I am seeing a little bit of wiggle. I think we all know all industries are having workforce issues. I think immigration is something that we will be able to move. It's going to take a while, but it's absolutely one of the solutions to our workforce crisis. And then empowering our direct care workers for technology, in caregiving and in scheduling. We've got to figure out how to do a better job with that. Also, again, empowering our direct care workers, just that word. We've got to make sure that these are the folks, I can't tell you how much I relied on my home care aide who was here 8 hours a day to tell me every night how my mother was doing. And if there was ever a change in her condition, that's exactly what the home care aide picked up. And how important is that? I never like to say that we just do non-medical or we just help with ADLs, because the more important thing direct care workers do, they're like the eyes and ears for the doctors, for the families. They're the ones that immediately see any kind of change in condition and can alert us to it. The last one is encouraging the states to take a look at evaluating the benefit cliffs. I know I was in West Virginia a few months ago, and I know West Virginia is one state that is indeed looking at benefit cliffs. When I talk with our members, they'll say, you know what, Vicki, my competition is not the home care agency down the street. It's usually unemployment or welfare. So we need to take a look at that. And we need to not, make it a negative to work more hours, but to figure out how to make both of those issues work in sync to encourage people to stay on the job, but at the same time, not to lose their benefits. And I think Dr. Werner pointed out that childcare is a huge issue to us. When we see call-offs happening, it's usually because of childcare issues and transportation. So that's another thing we're looking at. So those are the recommendations for the direct care workers. If you go to the next slide. I just wanted to make mention, and I believe these are my last two slides, Sean, that the Medicaid proposed rule that came out a few months ago is something that is very, very important to us. If those of you are not familiar with this is the rule that CMS just put out, where it would many things and many good things regarding trying to standardize Medicaid. But the one thing that is of concern is that every agency receiving that reimbursement would have to give 80% of that reimbursement toward wages, and only 20% could go to administrative costs. Now, we met with CMS just last week. There was a whole group of national providers, and a lot of the things in that proposed rule are really good. Transparency on how they do rate setting, stakeholder involvement, all good. Performance indicators, again, trying to standardize a bit the Medicaid program. This 80-20 rule is, I get it. They're trying to increase the wages, and I would not debate that. We're just concerned about the way they're doing it, and we offered some alternatives. So that's a really important issue. July 3rd was the deadline for those comments. We heard that they had 2,000 comments. So I know ours was like 80 pages. So I'm sure they're very busy looking at the comments. Hopefully we'll see something soon about where it goes from here. President's executive order had a lot to do with home care, but it also had to do with family caregivers. Family caregivers are so important to this country. We are very, very focused on how do we keep supporting family caregivers. I always say that when you've got a great professional caregiver, meaning a direct care worker, and a great family caregiver, you've got a golden experience when it comes to home care. There's no other healthcare provider that relies on family caregivers more than we do. And so it's important for us to continue to support them. I think federal government is doing that in so many bills that are coming out for family caregiver support. Better Care, Better Jobs is another real good bill that has to do with Medicaid and expanding it. The ACT caucus is another one. This is a caucus that just has been revived to deal with family caregiver issues. And then we've got a lot of bills, the Home Care for Seniors and the Elizabeth Dole Home Care, all about expanding home care, financing home care, and trying very hard to make it easier for families to continue to pay for home care, We want that. We know that government can't take on the whole responsibility. So we've got to do whatever we can to keep supporting and motivating people to plan for their long-term care needs. And last but not least, this was one of the slides that if you want to change one more slide, this was another provider survey results that we did share with CMS last week. When we talked about that 80-20 rule, the majority of our respondents expressed the first expenses to be cut, if we could only use 20%, would be training and competitive employee benefits. Just the reverse of what CMS is trying to do. In that rule, CMS is trying to elevate direct care workers. All agreed, appreciate it. But in the end, that 80-20 would hurt us by not allowing us to do training and do more employee benefits. So thank you so much. I guess, Sean, I turn it back to you so we can hear from April. Appreciate the opportunity. Thank you.
Vicki, thank you so much. And please be thinking about what questions you'd like to ask Vicki or Dr. Werner as we turn to our third presenter this afternoon. And by the way, I saw some folks in the chat asking about whether you will get a copy of these slides. You definitely will if you were registered for this webinar, or if you are on our mailing list, we will send you a copy of the slides as well as a link to the recording of today's program. April Young is joining us today, and she is Senior Director of Strategic Initiatives at Advancing States, the organization that represents the nation's 56 state and territorial agencies on aging and disabilities and long-term services and supports directors. She manages a variety of projects related to business acumen, the direct service workforce, and social isolation. She also serves on several state technical assistance teams. Previously, Ms. Young served as the Senior Director of National Core Indicators, Aging and Disabilities, NCIAD at Advancing States. Before joining Advancing States, she worked as a policy advisor specializing in LTSS for the Texas Health and Human Services Commission, and she has extensive experience with HCBS programs. April, welcome. The floor is yours.
Hi, Sean, everyone. Thanks so much. Thank you, Vicki, for sharing all of that great information. What an informative presentation. And thanks for sharing about your personal experience as well. I'm going through some of that now, and it's just so different when you are living the work. As Sean said, go ahead and go to the next slide, please. We're a nonprofit membership association, and our members are state aging and disability and Medicaid leaders from across the country. Our vision and mission revolve around older adults, individuals with disabilities, and their caregivers. And our mission is to improve state systems, delivering long-term services and supports to those three main groups. We're preparing for our HCBS conference at the end of August and wanted to call out that on Thursday, we're trying something new, and we will have a direct service workforce intensive Thursday morning. And as I was scrolling through who all is on the call, I saw some of our speakers are here with us today. So super excited for that, and hope you can make it if you'll be attending the conference. Next slide, please. This is just a quick overview. I thought I'd touch on some ARPA information. We had an affinity group about a year ago. Also did some analysis on the ARPA spend plans from states. We'll also look at how some states are engaging directly with direct service workers and an initiative on data collection. Next slide, please. We collaborated with the SCAN Foundation, the John A. Hartford Foundation, Arnold Ventures, and the Millbank Memorial Fund to staff an ARPA HCBS Technical Assistance Collective. And there were 15 states that were part of that group and 6 sessions. And the first 3 looked at increasing wages and benefits, and the last 3 looked at career development initiatives. And I'll put some links in the chat toward the end of the presentation so you can see the report if you'd like. But states were split fairly evenly regarding whether they were planning on providing one-time bonuses or sustained wage increases. And one obstacle that we heard about with the bonuses via the pass-through funding was how to ensure that the money going to the provider agencies was truly going to the direct service worker. So some states developed attestation forms that were legally binding, and some states started requiring annual cost reports that showed how payments made to the agency were distributed across all categories. For the career development initiatives, those were, what was discussed there was how to create opportunities for direct service workers to advance professionally through training or experience. And one of the challenges that was noted to creating a training and career ladder for direct service workers is that state staff themselves are dealing with a lot of attrition and kind of dwindling in some states. And so it takes sustained effort to implement kind of a program like that. And so when state staff are turning over, there's some challenge there. But the 3 states participating in the affinity group that were working on innovative approaches to the retention through career paths and training were Washington. They launched a high school technical program in one of their education districts, and they celebrated their first graduates in the spring of 2022. Illinois established a community college partnership to offer standard courses for mental health direct service workers. They were also focused on developing a training program that will help direct service workers to be cross-trained and work within any kind of home community-based setting. And then finally, Ohio had a governor's task force aimed at establishing partnerships with universities, career and technical schools, and community colleges. And I think we heard that from a few states. That was not specific to Ohio, but a great example. Next slide, please. So Advancing State staff posted an updated analysis of ARPA spend plans. They're looking at spend plans from October 2022 through January 2023. And we just wanted to share some of the more common initiatives outside of increases or one-time bonuses. This is not an exhaustive list, but kind of some of the ones that came up more than once, some themes. One was public awareness and marketing campaigns, just ways to elevate the profession. Vicki touched on that earlier, and a way to help the public know these are available positions. It is definitely a profession. It's not something that people just do and don't get paid for. It's just elevating the reputation of the direct service workers. Training and credentialing, that was included a lot in the ARPA spend plans. Developing learning management systems, especially online, was a theme, module-based systems. Workforce wellness, providing response sessions, critical incident response sessions, what to do if something happens. Kind of in general, just looking at ways to support direct service workers. One state mentioned subsidized childcare, looking at paid sick leave. Increasing internship opportunities, including in-home settings, focusing on the pipeline of direct service workers coming in. A few states mentioned environmental scans and studies, kind of see what's out there, what's being done before making any decisions. One state was offering transportation grants to home care agencies to address barriers to direct service worker recruitment and retention. And another one was establishing a transportation kind of support fund for direct care workers. And then finally, development of mentoring and peer support programs. Having a little bit of support in the field can really go a long way, is what we have heard from direct service workers themselves, and also what kind of has been touched on in the previous presentations as well. Go ahead and go to the next slide, please. It's kind of a good leeway into the next topic that we wanted to mention, was how states are engaging direct service workers directly. Really focusing on collaborative engagement. We're working with the state of Indiana to facilitate a direct service workforce advisory board. And the people on that board are workers that are out there doing the work. They're not managers of those workers. They're not staffing staff. They are people out there working with individuals. But the truth is, we're hearing from other states as well that have started similar direct service workforce councils and advisory committees, from Texas to Maine, Colorado. We heard Alaska maybe had one in the works. So it seems to be something that is catching on, which is great. We're hearing from the direct service workers, and that their lived experience has been tremendously helpful to the state as they created their direct service workforce plan and implemented that plan. And then as they are working on how to implement, the state is continuing to reach out to the advisory board and just get feedback and input. And the state staff member that is working on this initiative has been really great about staying in contact and communication with the direct service workers. And I think they feel valued for being heard and having some of that state staff time. Some of what we've heard are that specialized training modules would be really helpful. Shadowing would be really helpful. The portability of training from agency to agency. And then also that support piece again, just having someone to call if there's an episode or getting a text from a manager, that kind of thing. And then I'll quickly touch on the last couple slides here about the state of the workforce survey. So the access proposed rule that Vicki was just mentioned about the 80% of Medicaid payments for personal care, homemaker, home health aid services. And also the requirement to establish an average hourly rate and post that. One way that states can help accomplish those issues is by taking part in the State of the Workforce Survey, recently adapted for aging and disabilities programs. So the information from this survey comes from provider agencies. It's aggregated data at the end of the data collection period. An annual report is posted and you can see the information by state. So it's not posted per provider. And then the last slide just shows some of what is included in that is vacancy rates, hourly wages, benefits, recruitment and retention strategies. So it's a really rich data set. I know that's pretty quick, but I want to leave some time for questions. Thank you all so much.
April, thank you. And we want to turn now to questions for all three of our presenters this afternoon. As always, you can type a question into Zoom. You can, I suppose, raise your hand as well, and then we'll try to look for you. I guess, have folks been looking in there to see if there's anything we need to address?
I'm sorry, I think I messed up. I just deleted a question I didn't mean to delete, but it was about the advisory board and if workers were compensated for their time and they do receive funding, or I think it's $40 after every meeting, so they are compensated. Thanks.
Great. Let's see. So I think there is one question there from Senator Milwaukee. Can you all see that? She's asking about Vicki, question for you, whether you all have data on community-based care agencies.
Yeah, I would just want to clarify when I think what she's asking, other types of agencies that help elders age on their own, and are you, for instance, like area agencies on aging? Is that what you're asking, if we have data on that and what they're doing? I'm not certain. I'm looking to see her name. I don't see it. I'm just trying to clarify what she means of other community-based care agencies.
Senator Milwaukee, can you hear us?
Can you hear me?
Yes.
Oh, great. Oh,
Yeah.
thank you so much for your presentation.
Yeah.
We have a number of not direct care like home aides, but
Right.
home health agencies, home care agencies also in the community where they will pick people up and, have them for the day. And I'm just wondering whether your association also handles those kinds of services, which seems to me would round out all the services in the community to keep our elders at home.
Yeah, that's a great question, but unfortunately, we're pretty much focused on the home care as providers, what they all do. You may be talking about Papa Pals, maybe organizations.
Not so much the area agencies, but more the actual providing, socializing services, health services that are in agencies that are based in the community.
I'm sorry, I do not have data, but you might want to check the National Association for Home Care and Hospice. That would include the home health agencies, or Centers for Independent Living is another national group that may have some other types of data on those kinds of organizations.
Thank you. Thank you for the work you do. Thank you.
Sure.
And we had a question from our friend Kezia Scales at PHI for April. She's asking, can you say anything more about states' public education campaigns? Where they've been tried? Any details on their approach or impact?
I can't speak to all states, but I'm going to turn back to Indiana again. We had just talked about this with the advisory board, and I love that that state's approach. Also, Peggy Welch is on the call today, so if you'd like to jump in or type in a response, please feel free. But they started with the direct service workers themselves and said, what would be important to you for a marketing campaign? What would you want us to include? And we heard include the full scope of what this job entails, include the rewarding aspect, include our voices in the marketing campaign. So all of those ways just to make it meaningful and also communicate the meaningfulness of the work.
Great. And I am just checking to see if they're awesome. Great. Well, we are just about out of time, folks. Unless there are any burning questions that we want to get to here before we end the hour, we do have one question from an anonymous attendee there in the Q&A. How many states have a certificate of need process for Medicaid personal care services, and has a review of state certificate of need policies impact on direct care worker availability been completed? Anybody have an answer for either of those questions?
A certificate of need for usually you'll find a certificate of need for home health in some states, but for personal care, I am not aware of any states that have that. I could be wrong though. I can't say that for sure.
I'm not either. I usually think of nursing facilities too for
From
certificate.
that, right? Of course, yeah, you're right, April. Yeah.
Well, folks, in the interest of time, I think we're going to close it down for this afternoon. We want to thank all of our panelists again for joining us. And a couple of quick notes before we go. First of all, if anyone would like to learn more about home care, the folks at Manatt Health are hosting a webinar tomorrow at 2:30 Eastern. It's part of a series about navigating the complicated care at home landscape. Tomorrow's webinar will feature a panel of healthcare leaders sharing real life experiences of how to work effectively across the ecosystem of healthcare providers, payers, and non-billing service providers. Check that one out if you are so inclined. Our next meeting of this network is coming up very quickly on the heels of this one. It's next week on August 1st, again at 3 p.m. Eastern Time. We're going to begin a focus on efforts to build career pathways in long-term care, something we already heard a bit about today as part of this conversation. We're going to be joined by one of Kezia Scales' colleagues, Amy Robbins, the Director of Advocacy at PHI, the organization that is the nation's leading authority on the direct care workforce. We will also be joined by a couple of folks in Hawaii who have been working on a collaborative cross-sector initiative to develop a career glide path for certified nursing assistant, CNA, to licensed practical nurse, LPN. We hope you will be able to join us. You see the link to register on this slide, and if you are on our mailing list, you should have received that link as well. If you are currently not on our mailing list, but would like to be, please reach out. As always, we welcome your suggestions for future meetings. Due to the challenges of summer scheduling and a number of upcoming events, we are planning for our next meeting after August 1st to be in the last week of September, and we will have additional details to share about that one soon. We are working to develop our National Online Resource Center, and we now have a launch page for our long-term care workforce policy efforts at the URL that you see there. Please send us your relevant bills, reports, resources, articles, and initiatives so we can populate the website with details about what is going on in your states regarding the long-term care workforce. If you would like to request on-site technical assistance services, please get in touch. We will be ramping up our promotion of those TA opportunities across various venues in the coming weeks. So if that would be of interest to your state, please let me know. And just a quick note that I will be in Baltimore next month for Advancing States HCBS conference that April and her colleagues have been planning. I look forward to possibly seeing some of you in Charm City as well, and hearing about all the interesting stuff going on in long-term care across the country. Those who have joined us for previous meetings may know that I always close things out with this slide. This is a picture that my sister took of my parents, who we were able to reunite last fall in the same room at a nursing home, only about 2 miles from where I live. Today, I close with this photo as a tribute to my mom, who passed away last week at the age of 83, following a 2-year struggle with frontal lobe dementia. Thanks so much again for joining us today and participating in the discussion. We hope to see everybody next week or sometime down the road. So long.